So our next speaker is Ardyn Nordstrom, who's assistant professor in the School of Public Policy and Administration at Carleton University. Her research focuses on how machine learning tools and text mining methods can improve the design and evaluation of development projects and policies. Ardyn has designed and implemented numerous randomized controlled trials, mixed methods evaluation, and cost-benefit analyses of projects with international agencies, governments, and NGOs.
Well, I just want to say thank you all. Thank you, Sonia, for organizing this and all the folks who've worked so hard to put this together. I think this is such an exciting combination of research and organizations, and I'm just thrilled to be here and hear what everybody's working on, because I think the stuff I'm going to present today really builds on a lot of the themes we've been talking about today and that we've heard so much about so far, especially these kinds of community-based approaches to try to improve education. I'm going to highlight two different projects that I've been working on for the last couple of years, and I'm going to highlight some of the ways we've tried to figure out how they actually work. I think Catherine mentioned it's sometimes very difficult to work with big organizations and really find a way to causally evaluate a lot of interventions when there's lots of things going on, right? That's an awesome way to design programs, but it makes it really hard to tease out which components are really, really working. And so I'm going to highlight a couple of projects today that have tried to answer the question, how can we engage communities, so parents, teachers, other community leaders within communities, to really try to support particularly girls' education? And I think this is, I'm going to do this by looking at a couple of projects that were part of the Girls' Education Challenge. And I think this is a really kind of an interesting way to tackle this program for two big reasons. The first is that this is the largest donor-funded program ever invested to try to improve girls' education. It's funded by UK Aid. It's now been implemented in about 17 different countries. Oh, I think earlier I told somebody it was 21. I got the number wrong. But it's 17 countries across 41 different projects in the last 10 years. And so I'm going to focus on two particular projects. So these are the highlighted countries in this map are all of the countries where Girls' Education Challenge projects have taken place. I'm going to focus on two that took place in Zimbabwe. And I think the interesting findings, so beyond just thinking about the impact of this particular kind of funding window, I'm also going to focus on this because a lot of these, or like basically all of the projects that were part of the Girls' Education Challenge, it specifically included interventions that focused on community-based initiatives. So really trying to think about these like bottom-up approaches to try to find ways to mitigate barriers that were specific to their communities and in how girls were accessing education. And so I'm going to focus on two different projects, as I mentioned. So there were two different experiments that I've had the opportunity to work on. What I mean by experiments, I know we've highlighted this idea of randomized controlled trials, which many economists are big champions of in the field, and I've had the good fortune of being able to work with partners who are really keen to think about how we can learn from the projects that they were implementing. And so the partners on the ground, we had a lot of different partners. I think there were 7 or 8 different organizations on the ground who were part of these projects, and they were really coordinated by World Vision International, so the offices that were working on the ground in different places within Zimbabwe. And so the first project that took place in the first part of the Girls' Education Challenge, which is now a 10-year initiative, but the first program took place between 2013 and 2016. It was called the Improving Girls' Access Through Education program. And so these two programs, I think, are interesting because they took different approaches to try to engage community members. And the first program really focused on just facilitating dialogues, like setting up an environment where folks within the community, as parents, teachers, educators, could all get together to discuss different barriers to education that were relevant to their communities. And then, so rather than kind of making any kind of like providing information, the focus of these engagement or discussions were really to try to identify solutions that would work within their communities. So a really bottom-up approach. And then from the kind of action plan here was that the focus of these engagement campaigns focused on trying to commit to the actions that could actually mitigate some of these barriers. And I should state this is based on like lots of theoretical research and theoretical frameworks that had been proposed in the academic literature and has now been kind of championed in CARE International's social analysis and action model. So this is kind of based in the academic research that we're all here to talk about how it can be useful, and now it's been built upon to be put into practice by a lot of NGOs. And that's including the one we're talking about today. And so the interesting thing about this randomized control trial, so the evaluation strategy we took here, or that we were participating in with here, we have a random set of treatment and control schools, and these eligible schools were randomly assigned to either receive these set of interventions or be part of the control group. I should say, the iGate program was actually initially intended to include more than just these community engagement campaigns. They were also supposed to include things like bicycle provision, providing books, providing teaching training, providing all sorts of other kind of clubs within schools. However, because of all sorts of administrative delays, these actually had a delayed start. And so this allowed us to kind of isolate the impact of these initial dialogue-based campaigns, which only took place, were the only things that took place before the midline data collection. And so this is a kind of fortuitous opportunity within the data and the timeline for how the interventions just happened to work out. And I should say one of the kind of important factors for what we call identification here is that these other interventions hadn't been widely known that they were coming within the so there was no like anticipation effects taking place within the communities that were receiving these interventions. And so we have this nice timeline where just between baseline and midline, we were able to focus really on the impact, or at least the short-term impact, of these specific engagement campaigns. And I think this is really exciting because often these are bundled, these kinds of engagement discussion programs are bundled with lots and lots of other things, which is really, I think it's an interesting model, but it does make it very difficult to figure out the impact of these kinds of dialogues directly. And so we were able to have this sample of about 942 people at the beginning of the study. We did have some attrition, which is fairly standard, but was a little high in this context, where we have about 820 people remaining at the end of or by the middle of the program, which is what I'm going to focus on today. And so after we do what we call like a differences in differences analysis, which allows us to compare these outcomes over time between treatment groups and the control groups, what we found is that the students who had been exposed to or were in these communities where these dialogues had taken place had improvements in enrollment. And I think this is really important to highlight because in Zimbabwe in particular, these students have extremely high enrollment rates to begin with, right? These are primary school students at the beginning where enrollment rates were over 90% initially. And so to see an improvement, even when you have already really high enrollment, is quite we were kind of mitigating these drops that we were seeing in the control group. We also do see an improvement in math, a slight improvement in math, but we really didn't see any kind of improvement in reading scores overall. And that's actually something that we've seen kind of consistently within these evaluations of these two different programs. And I would love to chat with education practitioners to think about why this might be happening. And I have some suspicions about why this would be happening, but I would love to chat with people who kind of figure out what's going on under the hood here. And I should highlight, this is work that I've been collaborating on with Chris Cotton at Queens and Eric Richard in particular, who's now at Chicago. And this is in a paper that's coming out, or hopefully coming out very soon, but it is all available online. There's a link at the end of my slides if you're interested in looking at like all of the technical details here. So I think this was kind of preliminary evidence to suggest that these like dialogue, community-focused interventions, at least in practice, had the potential to work. But when the Girls' Education Challenge zoomed out to think about the impact that all of their projects had after the first few years of the interventions, what they identified is that there's really a need for more detailed insights into how specifically targeting attitudes and behaviors can ultimately affect education outcomes. So more kind of targeted interventions to focus on these community attitudes and behaviors. And so that brings me to this second intervention. So based on that kind of call for where we need more evidence, the folks that we were working with in Zimbabwe designed a new set of interventions. It's a different name, but it still has a very similar acronym. So it's the iGate-T program. And this was again, another multi-component design where they tried to improve education outcomes, particularly for marginalized girls. And so I don't have the time to talk about all the different impacts this has had on children with disabilities and children from particularly vulnerable subgroups, but we definitely have a lot of that in the data, so I'd love to chat more about, since there seems to be a lot of that going on in this room. So I will highlight that the interventions were a little different in this case. So we have not just these kind of community dialogues, but in those meetings, they were specifically encouraged to consider how their own attitudes were contributing to barriers within education for girls in these communities. And so they also focused on training these kind of community mentors that were embedded within the community and were kind of champions of the discussions that were happening at these meetings, and then would also provide teacher training to really focus on how teachers' attitudes towards struggling students and girls in particular were contributing to barriers within the classroom. And so I should highlight this also did take place throughout COVID, but because we have this randomized design, we're able to think about, and the school closures we've checked, and we were again working with lots of local partners and academics in the field. So I'm very happy Catherine highlighted that, because that's something we've been kind of really pushing to work with local academics on the ground as well. And this is something, so we were able to at least tease out that the school closures were equally impactful within the different communities. But what's really interesting is that there was this community learning aspect where they really did focus on trying to provide additional training or access to learning based on with the teachers that had been trained through this program. So while schools were closed, they still had access to some kind of learning resources, but they were all community-based learning resources. And so like the previous interventions, we were able to again use this kind of location-based randomization approach where we had 37 treatment schools, 37 control schools, and we had about 1,200 people in our sample by the end of the program. And this time we were able to also collect data on boys, which was really important and something we wanted to highlight because the Girls Education Challenge hadn't historically been collecting data on boys. And so just like in the previous study we did an impact evaluation, we also have a lot of qualitative data where we're able to bring in tools like text mining and natural language processing to help analyze that qualitative data. I don't have 1,200 qualitative long-form interviews, which is just amazing, but we do have about 80 interviews, which until now I thought was a lot of qualitative interviews. But so we were able to use this kind of mixed methods design to try to figure out not only what the causal impact is, but then try to explain some of these mechanisms using innovative tools like text mining. And so just to give you a highlight of what we find, we do see that using this kind of sentiment analysis approach, we're able to see that there are these pretty large shifts in the kind of emotion or sentiment that people respond with when we ask them about how communities are supporting education or how their communities are supporting girls' education. And so we see at the beginning, folks tended to have kind of neutral, maybe slightly positive attitudes towards girls' education, and by the end of the program, we'd seen this substantial improvement in how they were talking about girls' education. They're much more positive in the way they talk about girls' education. And this is something we've corroborated across our multiple data sources. So this is from qualitative data, but we've also corroborated it with what we're seeing in kind of more the causal evaluation that we're able to do with the quantitative data as well. And so turning to that quantitative data, we also wanted to think about how these programs are also affecting education, right? We're here to think about how these programs can affect education. And what we're seeing is that for students who were already doing pretty well, the program didn't necessarily have any kind of added impact on their outcomes in terms of like test scores. But what we see is that for students who were underperforming already, so these struggling students, the students who are struggling the most, this is where we see the program has had an impact on test scores, where they're doing significantly better at the end of the program. And so I think this highlights the kind of potential for these kinds of interventions, these community-based interventions, to really improve the education of particularly struggling groups. But one thing I really wanted to highlight, and I think is a really powerful way to answer questions about like what we should be doing in different contexts is it cost effective? And so I've done a lot of work on cost-benefit analysis and really thinking about how we can model the benefits and costs of different interventions. And so what we did after we found the impact studies, and I think there's a really important tie here between measuring impact effectively and really understanding the impact of programs, because that allows us to then kind of interpret how that will ultimately contribute to like the overall value or benefits associated with the program. So when you have good impact evaluation methods, you can also then use that to inform a cost-benefit approach. And what we were able to do by basically estimating like how many equivalent years of schooling we were getting by improving learning overall, we see that for every dollar that this program has invested, including like opportunity costs and indirect costs of time, of those involved, we were able to get about $1.67 back. I should highlight, while that is better than 1, which is kind of the break-even ratio, we want to be able to compare that to other types of interventions. And so something I've done and more recently, or kind of with other projects in Malawi, in particular with the government of Malawi, we were able to compare the benefit-cost ratios of different education programs to really think about how we should be allocating resources in this sector. And so I know I'm out of time, so I'll just wrap up real quick. I think highlighting here, there is evidence here that these kind of community-based approaches can be effective. And one thing I wanted to highlight is in terms of like thinking about where the research in this area can go. So now I've highlighted the evaluation of these 2 different projects. Now I'm zooming out, thinking about the impact of all of these projects. So we just got access to the data from most of the other 41 projects. And this is somewhere, an area where we're able to use things like machine learning to really unpack where these different types of interventions are most effective, the communities they're most effective in, the contexts that need to be in place for these types of interventions to be most effective. And if you're interested in this, I did what all the cool kids seem to be doing and put a QR code. So you can just take a picture of the QR code and you can find lots more details on all of this research. So thank you again for organizing, and I will conclude.